and welcome to Ask Your Academic. Today's session we will cover the MSc Critical Care, MSc Healthcare Advanced Practice, MSc Health Services Management and MSc Advanced Nursing Science. We've still got some of our academics joining us, so hopefully a few more will be joining us too. On our screens just now you should see Sue Campbell, Katie Duncan and Natalia Jonsson-Skradol. So, and then we've got Clare McFeely. Hi Clare.
Hi there, sorry, a bit late.
No, you're okay, we've just started. So we've received a number of questions before today's session, so we're going to run through those. If you have any further questions, we've got our chat box, so if you pop them in there, we'll try and get to those too. If after the session you have any further questions, you can pop an email to the administration team for each programme. Those email addresses can be found on the programme pages on our website, but I will also pop the details into the chat box along with some helpful links for you to have a look at. We are recording today's session, so we do plan on sharing that link with you after the session. It'll likely be after we've covered the other sessions that we've got running too, so you'll not probably get that today or tomorrow, but you will get it shortly. So we only have 30 minutes, so if it's okay with everybody, I think we'll get started on our questions just to cram as much in as we can. So our first question we have is, what are the differences between the programmes? So for this one, could we just give an overview of the different programmes that we have? Sue, would you like to start?
Hi, nice to see you all. So my name is Sue Campbell and I am the programme lead for the MSc in Health Services Management. So what we're doing with this programme, which maybe makes it slightly different from some of the other ones that are here today, is it is very much a focus on leadership and management. So we're not looking at your clinical skills. We're looking at how you might go into a more management and leadership role in health services. And we take health services as being very broad. So that could be hospitals, it could be working in primary care, but it can also be, working in pharmacies, research industries, and for people working in like health policy. Sort of developing new ways of doing or delivering health services. So happy to answer any questions on health service management.
Thank you. Katie, would you like to give us an overview?
Hi, yeah, I'm Katie Duncan. I am one of the clinical teaching fellows and I help to coordinate the Critical Care Masters programme in Critical Care, which is based in the Queen Elizabeth for on-campus students and obviously online for our international students who are online. So for our Critical Care Masters programme, it's a bit more clinical. So we have, for on-campus students, that is, we have bedside teaching in our units, which are kind of state-of-the-art ICUs and HDUs in the Queen Elizabeth in Glasgow. We have, some of our assessments are done clinically with patients or with simulated patients, and a lot of our learning content is based on clinical materials, and it's based at a level that is accessible to people from all different backgrounds who've got some experience in critical care. We also have an online programme which is still very clinical based learning outcomes, but obviously you're based in your own hospital and kind of applying what you've learned to your own practice in that kind of way. We also do parts of our course is about research and scientific writing skills and that kind of thing. So we do have a lot of, the more kind of research based for people who are interested in looking into that side of things, and obviously dissertation at the end, which is a piece of research. So yeah, it's a good mixture between clinical and academia.
Thank you. And Clare?
Hi there. So we have two programmes. One is a Masters in Advanced Nursing Science, which is for nurses specifically. And we also have a Masters in Advanced Practice in Healthcare, which is open to health professionals or people with a relevant first degree. And really it's I suppose, aimed at people who are looking at expanding, developing their role or moving into a more senior role. So we have a focus on research and academic skills in the first semester. And in the second semester, look at leadership, education. It's a bit kind of broader in terms of that. We do have an optional course which focuses on acute and critical care, but that is more about management than clinical skills. So there's no practical clinical component to that. And we also have an option to look at global health, and we can have a named degree there. And in our final year, as with the other programmes, we have the kind of self-directed independent project.
Great, thank you. Our next question is about the MSc Health Services Management, but again, I think this is about job opportunities. It would be good for to cover all programmes. So what are the job opportunities in the UK after the MSc in Health Services Management?
So I think there's a range of options, and it does also depend on what maybe your undergraduate courses as well. So your masters will add to what you've already done before. So studying at master's level, you know, no matter what masters you do, it does show that you can critically analyse, that you've got the sort of skills to be evidence-based in your practice. So there's those kind of generic skills that cut across all programmes. Health service management is very broad, as I said before. So, you know, it's difficult to sort of say, well, there's this job or that job. I mean, we've got students that have worked in administration in hospitals, students that have worked for non-governmental organisations, so third sector charity organisations, perhaps doing something like policy work. A lot of our students are international. So some have stayed in the UK and some have gone back to their home countries. So it's difficult to say sort of exactly, you know, what you can do with it, but there are quite a range of options.
And Katie, is there anything you'd like to add in for critical care?
So I put this question to our team to say, what would you suggest? And actually, one of our team has done the master's programme. She's a pharmacist. She did the critical care masters with the University of Glasgow, and is now helping kind of going back. And she said that it definitely helped her get her promotion into kind of senior pharmacy role. As Sue said, any kind of master's programme does show that extra level of dedication, and it just kind of puts you ahead when it comes to applying for jobs and expanding into different roles, you know, with students with nursing backgrounds who come and do our masters sometimes go on to do, you know, advanced nurse practitioner roles or the advanced critical care practitioners, which we have in our unit. So it just kind of sets you ahead and opens up doors in the kind of way of working in a slightly different role that's maybe more responsibility or more clinical or that kind of thing.
Thank you. And Claire?
Yeah, I would agree. So there's not a kind of specific role that this programme leads into, but most of our students are looking to progress to a more senior role within their kind of current job. We have a lot of international students, as Sue says as well, and very often they're coming over in preparation for that kind of next step in their career. We also have quite a few students who go on each year to pursue a PhD as well, so they've got that kind of academic grounding there. And others hoping to move into educator roles and become lecturers and teachers. So yeah, I suppose one thing I would make clear is that it's a really helpful grounding, and Katie mentioned advanced nurse practitioner roles there. It's really helpful for that, but there are dedicated courses to become an advanced nurse practitioner. So this master's doesn't lead directly to that, but it would be of value to people who are thinking about that.
Great, thank you.
And Naomi, I maybe just add, you know, it doesn't, if you were a nurse or a doctor, it won't give you the registration if you're an international student onto the, you know, the sort of governing bodies that we have in the UK as well. So it's not a kind of fast track to getting on the Nursing and Midwifery Council register or anything like that, just to be aware.
That's great, thank you. So what should I expect as a new MSc student? Would anybody like to take that question?
happy to start again. I think you have to try and settle in quickly. I think, and arrive in good time so you're ready. I think you should take advantage of all the sort of generic courses that are available and to support your learning in terms of academic writing. I do think you need to be prepared to work hard and as best you can kind of hit the ground running, as it were. And yeah, I mean, just as a sort of, also to take, I suppose, to take some time off and enjoy Glasgow, but, don't feel like you're studying all the time, but do be prepared that it's a very, very busy year.
Anyone else like to add anything else? Any words of wisdom?
I mean, I would add that they're all demanding programmes and that they are all full-time programmes. And so we expect our students to manage their time full-time. And so good study habits from the beginning would be a real asset. So planning your time, we see there's it's such an area of interest, that people can get lost just browsing and looking around. But we can give some advice on using your time in a structured and a focused way. But yeah, I would echo Sue's words to take every learning opportunity, whether that's formal learning or informal learning, engaging with your peers, but to really use the time, because you need all of the time that you have.
Great, thank you.
Could I add something also?
Yes, yes, please do.
I think it might also be good to take into consideration that on our programs there is a lot of writing, so it might also make sense to be prepared for that. It's not just exams or multiple choice questions, but there are essays to write.
Thank you.
Yeah, I would echo Sue's hit the ground running ethos. I do think that with master's programs, especially for people who've come from an undergraduate degree or even been working clinically for many years and then come suddenly into a master's program, it is a huge transition, and I think it does take some time to adjust. But they're busy courses. There's a lot to fit into the semester, so we do have to kind of hit the ground running and just get started. So I think just be prepared for that adjustment and know that the whole team are here to support you. And especially for those who are coming from abroad, maybe never even been to Scotland before, which we have a lot of in our course, and we're all here to help them adjust and help them settle in and just get sorted with all the things that they might need help with, like things like getting registered with a doctor and getting a flat and that kind of stuff. So apart from the studies, there's so much that we can help with and support with and advise about as well.
Thank you. So how should I prepare myself for the course in advance? Do we have any prerequisites for the course, such as any subject or text material to read? Sue, we'll just start with you again, if that's okay.
Yeah, sorry, there's a bit of a noise outside. For anyone that's doing health service management, I can send on some links for some pre-reading, but none of that would be essential. But perhaps might give an overview of kind of how the health systems work in the UK. So this would be freely available, from the documents you can download on the internet. So happily for you to get in touch with myself or Natalia, and we can send that. But we don't expect you to have done a lot or much in advance, but just to be very ready when you do get here to start.
Thank you. Katie, is there anything for yourself for critical care?
I don't believe there's any prerequisites or anything that you need to read prior to the course. There'll be plenty to read when you get here and you start. But no, I would say, I wouldn't worry about getting sorted. If you're into the course, you've been accepted, you're starting, you've done everything you need to do, and we'll sort you out when you get here.
Great. Anything to add there, Claire?
No, just that all of our courses have an online reading list as well, and all the resources on the reading list are available from the library. So perhaps in those early days when the students start on the programmes and they get enrolled and they have access to those lists, most of us have it as essential reading and recommended reading. So it's a good place to start once you get here.
Yeah, I would also just add to that, our programme handbooks are an absolute treasure trove of information. And it seems like a lot at first, but it's such a good thing to just have a quick read through and then refer back to whenever there's questions, because there's a lot of answers in there.
Great, thank you. So this actually links back to a question that we've got in our chat box here. Are there any supportive writing groups to help improve my writing skills?
Natalia, do you want to take that one?
Yes, that's an important one. So we have the what's called LEADS, the Learning Improvement and Academic Something Service. It's a unit within the university that offers a range of academic writing courses, and that we would definitely recommend to everybody who enrolls on our programs. In addition to that, if you get in touch with your program leads or course leads at the start of the program and discuss with them your particular interests, or maybe if you're aware of any difficulties that you might be having with academic writing, they would be able to advise. On the critical care programs, we recommend that everybody who joins our programs take the research and academic writing skills course first, even if it runs in parallel with some of the other courses on the program. It's definitely worth it. As experience has shown, those students who took this course first, their progress on the program has been much better. Katie, would you agree with that? Yeah.
Yeah, absolutely.
That's great, thank you. Is there any practical work or training to apply what we learn?
Not on the health service management programme. It's all academic, theory based.
Yep, and similarly on our master's programmes, it's a theory-based programme. So we have explored different avenues to try and get students, particularly international students, some engagement with our health services. But it's not been feasible for a number of reasons. Access is very tightly controlled to clinical areas, and so we've kind of consistently come up against that barrier. So there's no clinical component in our course. And similarly for colleagues in other universities, because we've been trying to kind of share practice and see if there's opportunities.
So there is some opportunities for being on the units in our course for our on-campus students. We have some bedside teaching sessions, and as I said, we have simulation sessions, but they're also held at the hospital. So you do get some hands-on experience, and I think it's really, really beneficial for students coming from all over the world to see what is it like to work in an ICU or a critical care unit in Scotland. And we're very blessed to have such an amazing unit with such amazing staff who are very supportive of our programme. The students will always be accompanied by a consultant, an ICU consultant, to make sure that they feel supported and they're never left alone. But yeah, so we do have it depends on what course you're going through. So obviously some of our courses are a bit more academic, a bit more theory based, and some are more clinical, like sepsis, for example. So when you're on those kind of courses, you will be you'll have some opportunities to be clinical.
Great, thank you. The last question I've got here, which was just recently submitted, was to find out a wee bit more about the assessments for the different programmes. Sue, I don't know if you'd like to start that one.
So in the health service management programme, it does depend a little bit which modules you choose, but most of the assessments are like essay based or preparing a report. So as far as I'm aware, we don't have any which are an exam. They're all kind of written assignments, writing a policy or something like that. So they do require quite a lot of writing skills and critical thinking.
Could I add something to this also in general? If you Google the University of Glasgow course catalogue, you'll be able to just type in the name of the course, and you can get all the names of all our courses from the program information web pages. And you will there have an overview of the general information concerning the course, including the types of assessment that the course includes. So that might be a good thing to do.
Great, thank you. Anybody else like to add anything else there?
Just to say that for some of our courses, there's a presentation component as well. So partly presentation and partly written assessment, but the bulk of the award is for written assessment.
We've got quite a varied catalogue of assessments in our course. We have a lot of written kind of essay-based assignments. We have some kind of video assignments, so film yourself talking and or make a podcast, record your voice. We have some that are kind of case-based, so describe a patient that you've seen or cared for with a thyroid condition. A lot of critical appraisals of scientific articles, and we also have simulation assessments, so we'll assess you with a simulated mannequin. And we also have an exam that's a kind of data interpretation exam for just looking at kind of arterial blood gases and that kind of thing. So it's nothing to stress about, but a very kind of wide selection of assessment types.
Great, thank you. That's all the questions that I've got that were submitted beforehand. I don't know if anybody watching currently has any additional questions. We do have a few minutes that if you pop any questions in the chat box, we can have a look. Oh, there's one here in our Q&A. Are there any internship opportunities, maybe in a healthcare unit, hospital or primary care, or a healthcare management consulting firm?
On the health service management, there are no intern opportunities at all.
Great, that was an easy answer. Yeah, if is there any other questions you'd like to submit, or is there anything any of our academics would like to pop in, just that you think is maybe not covered or that might be useful for everybody watching to know? No, are we all right? Well, if there's nothing else to add and if there's no additional questions, we'll not keep you any longer. And what I will say is, if after today, if you do have any additional questions, please do get in touch with our programme administrators, and they will follow up with you on anything you need to know. As I said, we are recording this, so it will be sent in the coming days, so you can catch up on anything you might have missed. So thanks again, everybody, for joining us. Please take care of yourselves, and hopefully we'll see you all very, very soon. Thanks for joining. Bye-bye.